Okay. طيب. السلام عليكم ورحمة الله وبركاته. Good evening, everyone. Welcome to our webinar. My name is Nawaf Zahrani. I'm a specialist in the reporting and measurement department at the Saudi Patient Safety Center, and I will be your moderator for today. I will just give you brief information about the center. The Saudi Patient Safety Center, established in 2017, is the national authority dedicated to advancing patient safety across Saudi Arabia. Across Saudi Arabia's healthcare sectors, aligned with the Vision 2030. It promotes a safety culture and reduce the preventable harm through evidence-based policies and innovative virtual training. Also, the center deliver webinars, courses with interactive simulations and multimedia for healthcare professionals, students, and administrators, ensuring accessibility and data privacy. Today, we will be hearing a presentation from Dr. Muhammad Al-Gahtani on effective communication, the cornerstone of exceptional patient safety. Dr. Al-Gahtani is the Director of Organizational Excellence and Development and the Lab Hematology Blood Bank Consultant at the Security Force Hospital in Mecca. With extensive experience in the healthcare sectors, he holds PhD in cardiovascular medicine from the University of Nottingham, and he certifies as international technologist in hematology. Also serve as a certified inspection team leader with the College of American Pathologists and a Sibahi surveyor. Now we're going to be moving to our session. Please welcome Dr. Muhammad Al-Gahtani to deliver the presentation on this very timely subject. Please, if you have any question during the session, you have the icon, the Q&A icon, the question and answer icon. Just submit your question, and in the end of the session, we're going to be answering your question. Thank you, and you have the mic, Dr. Muhammad.
Thank you so much, Dr. Nawaf, for the kind introduction. I will not introduce myself. You have done that part. As you said, I serve as the Director of Organization and Excellence and Development at Security Force Hospital, Mecca, and I'm lucky to be in Mecca and to serve a very special niche of people who are living in the city of Mecca. Before I begin my presentation, I would like also to extend my gratitude to Saudi Patient Safety Center for the invitation and the commitment to advancing the culture of patient safety across Saudi Arabia and their leadership in patient safety continues to inspire the excellence in healthcare delivery. Before I jump into the objectives of this presentation, I would like to highlight that, as all of you know, healthcare environment is very complex, and we normally focuses on metrics, on KPIs, on OKR, on protocols, SOPs, technologies, on complex system, but behind that, there is something that we always forget about, which is communication, and not only communication, effective communication. Because communication is not just about what we normally say. It is about making sure the recipient of that communication language understood what have been said. Because when communication fails, the patient safety is the first to suffer. Inshallah, during the presentation, I will try to go through these objectives interchangeably. I will start by the critical role of communication in ensuring patient safety. As the research and experience have shown that the breakdown of communication are the most preventable causes of harm in healthcare. Then we'll move to the second objective regarding the identification and overcoming barriers regarding the communication, which might include the language differences, which could be cultural issues, and also we will go through some of the strategies to overcome these challenges. Thirdly, we will discuss a very important tools, which is structured communication tools. And I'm sure all of you know SPAR, which is stand for the terminology for effective communication. And it's always one of the areas that is always the points which is asked in the exam, which is the certified patient safety exam. And finally, I will go through three scenarios, very straightforward scenarios, and I would like someone to volunteer to give a title for these scenarios and what is the outcome as a result of these scenarios, and also what might be the effective strategies to overcome the barrier in those scenarios. So firstly, before we deep dive into the presentation, let's go and see this video, and we'll back with some questions.
She really taught me how to live and how to love in a way that I didn't really know before. We had a whole weekend planned of activities and making our way back towards the marina, and something went terribly wrong. There was a huge crash and everything went blank. Jennifer was thrown forward and crashed through the cabin door down to the lower galley, and I spent the night in the hospital myself, so I was unaware of what was really going on until the next day. That's when I learned she had a lot of continued complications with her breathing. We had gotten Jennifer to the place where she was now able to speak. She was able to write, and she wrote in big letters that we're gonna make it. And at that point, I had every reason to believe that that was true. We were so excited because Monday morning she was scheduled for a barium swallow test. And that was the last big hurdle. With a green light on a barium swallow test, she was going to go home. I since have become very familiar with a term called TEF, which is a tracheoesophageal fistula, which is basically a hole that establishes itself between the trach and the esophagus. The barium went down her esophagus and then was quickly seen to migrate into her trach and then quickly spread into her lungs. They were blowing her full of air for 6 hours. Instead of it going into her lungs, it went into her belly. They told me that Jennifer was in cardiac arrest for over 14 minutes. She was so oxygen deprived that everything just shut. How is it possible that on Monday morning you have a definitive diagnosis of a TEF, but Tuesday afternoon she's back on a positive pressure ventilator with no isolation and no protection from that hole that they had just discovered? I've since learned a lot about electronic medical records and something that the industry talks about, which is the problem list. Problem list is a idea where you take all of this aggregate information and the computer systems try to organize it. The most problematic condition is sort of forced rank to the top, and then everything sort of in descending order follows thereafter. It's tricky, but it's where electronic medical records have to go, because no human can possibly absorb as they're coming onto a shift, whereas they're assigned a respiratory case like Jennifer's. I have 4,661 pages of her medical record. One page, one paragraph. Talks about the TEF. So what did the caregivers know at the most critical time? I don't know. They clearly didn't know she had a TEF. We all go into those environments with a false sense of safety. The truth is, there's so many moving parts. There's so much information. It's not well organized. It's not well communicated. It's not well coordinated. I don't believe for a minute that Jennifer's caregivers were intending to do any harm to her. It's just a case of they didn't know.
So I'm not going to say I don't know. So this is a tragedy happening as a result of ineffective communication. So I would like to hear from you guys. What are your thoughts about it, about this video? Can you hear me, Dr. Nawab?
Yes, I hear you.
Yes. So as the video explained the situation of Jennifer and ineffective communication and always the stress of the healthcare, the complexity of the healthcare system, it render people to say, I don't know. But by learning the effective tool to communicate across healthcare provider, we must prevent this from happening.
Exactly.
So communication, a brief, simple definition of communication as Cannon and Powers and colleagues defined communication. It's a process by which information is clearly and accurately exchanged between two or more team members in prescribed manner using proper terminology and including the ability to clarify or acknowledge the recipient of the information. So it is about exchanging information with proper terminology and the ability to clarify, making sure when you send the message, you want the receiver of that message to acknowledge he understood or she understood what has been said. Because terminology cannot use medical terminology to send the message to a patient with a minimal knowledge about medical terminology and so on. So the definition highlight, as we explained before, communication is not just about speaking or talking. It's about structured exchange shared language, and active confirmation. So making sure, as I explained, the message sent is the message received. So why it is so important to have effective communication? Because the statistics shows that ineffective communication is identified as the root cause of nearly 66% of all reported sentinel events. That account for 2/3 of the sentinel events, or 2 out of every 3 serious safety events that could uh, potentially have been prevented with better communication. And also the statistics shows that communication is among the top 3 root causes of sentinel events. And that's over the year sent a alarm to the healthcare provider, to the institution all over the world, to raise awareness and to have a campaign to leverage the capabilities of a healthcare provider about not only communication, but using tools, or the effective tools, to accomplish communication. So as you can see from the penguin cartoon, the sender or the source of the information and the recipient of that information. Um, the even when both the sender of that message and the receiver are saying the same thing, due to the complex system, as we explained, of the healthcare, the fatigue, the distraction, and other barriers, this might block the message and make sure the communication between the sender and the receiver is the same. And in that regard, I would like to point out to certain things that we should consider when communicating information among healthcare providers. The first point is regarding the audience. So who you are talking to? Are you speaking to patient? Are you speaking to physician, family member, or a technician? Why is that important? Because the tones, the terminology, the timing, it should be adjusted accordingly to the type of the audience. Also, we should take into consideration factor like the emotional state and the background when considering communication. I'm sure that as a healthcare practitioner, sometime um, you become desensitized, even though if the sender of the communication sending a message about a critical situation about a patient. However, if you are sending a message to a patient, the situation is totally different, because patient uh, is different from the healthcare practitioner. He's not in the complex system always like the healthcare practitioner. So this is something we need to pay attention to. The second point is the mood of communication. We have to think about the I would say the medium of the communication. Are we communicating verbally in person, or it is through the electronic medical records, or are we communicating as everyone now is using through the WhatsApp? And I'm sure that sometimes the message you want to convey through the WhatsApp, it might be understood differently by the recipient of that message. Third factor, or third point I would like to pay attention to, is the standards, or the use of standard. As I have shown in the first slide, the use of effective tool to communicate, and one of the effective tool is the SPAR, which stand for Situation, Background Assessment, and Recommendation, which can help to clarify the communication language and making sure that you are focused and delivering the exact information. The last point is the non-verbal communication, and this is regarding the body language, the tone of voice, the facial expression, as these things often say more than our words. So, standards for effective communication. Whenever we are giving verbal handoff, documenting patient status, or briefing your team, we have to have a principle that can dramatically improve and clarify the safety of the safety to the patient. We have to start by completeness or complete. We have to communicate all the relevant information, meaning that the information that we across is complete and not missing any steps that are important. We have to make sure the communication language is clear. It convey the information that is plainly understood. And in that regard, we have to avoid jargon when speaking to the patient. For example, if we are going to speak to patient and explaining the situation of the patient as if the body temperature is rising by saying he having or she is having a febrile, or by explaining laboratory test of CBC, or by telling the patient the results or the sample or the lab test is not routine, it's stat. So a patient wouldn't know about this terminology. Also, it's very important to be brief when communicating the information and trying to be as concise as possible, because as we explained is the healthcare environment is high pressure setting, and we meant to have the communication very concise, focused, and to the point. Last but not least, timely. We have to offer and request the information in appropriate time frame, and also to have to validate and to acknowledge the information, because when communication is complete, when communication is clear, when communication is brief and timely, we as a healthcare professionals, we reduce confusion, we improve coordination and protect patients. So I would like to drag your attention to the 7 C's of communication. This is something we need to understand, and I touch on some of these terminology in the previous slide, and the rest are shown in the circle. And I would like to, draw your attention to the consideration is as one of the factors that is important in communication. We have to know about the listener perspective. We have to consider the knowledge level of the recipient of that information, and as I explained, the emotional status. The concreteness of communication, it is about the being specific, and using facts. For example, instead of saying the patient is unstable, say blood pressure is dropping. So this is sounds good and getting the message or the communication across safely to the patient. We all as a healthcare professional know that SPAR is one of the tools that is most effective in communication and as a framework in healthcare setting. And it stands for situation, background, assessment, recommendation, or sometimes we call it request. We'll start by situation. We have to start with the problem. What is happening right now? For example, Mr. Ali's blood pressure has dropped to 80, 50. And this is explaining the situation. Then we go to the background, give the clinical context. For example, we say a patient was admitted with sepsis, or he or she on IV antibiotic and fluids. So this is the background about the patient. Then we move to the assessment. What do I think the problem is, and or what's going on to the patient? And finally, the recommendation of what would I recommend or what do I need from you. So the beauty of SPAR method is that it is adaptable. It can be used everywhere in the healthcare setting or in the healthcare environment. It can be used in the operating theater. It can be used in during ward rounds, in emergency situation, and um, even with non-clinical staff who need to communicate risk or to escalate concern. Above all of that, we need to not forget to introduce yourself. Another way of communicating is the simple way of transferring of information along with authority and responsibility during the transition in patient care, which is termed handoff. And there are several key principles in handoff. Is first that hands-off is more than information, is not um, about telling the next shift what has happened. It's about making sure that they are equipped to make safe decision. And this includes sharing clinical reasoning, not just raw data. Then the second principle is about the opportunity for clarification. The opportunity for clarification as good handoff also create space for question and clarification, because hands-off is not a monologue. It is a dialogue. It happens between two individuals, confirming understanding, clarifying ambiguities, and allowing the incoming provider to speak up. The third principle is transfer of responsibility and authority. Which means that authority transfers alongside the information, which means that the new provider is now responsible for decision and the healthcare outcomes. So as explained before, proper handoff include the following component: responsibility, accountability, uncertainty, acknowledge by ensuring the hands-off is understood and accepted. And as I explained, it's is a kind of opportunity to evaluate the situation for both safety and quality. So this is like an example exercise for you to be trained on as a handoff exercise and to develop the checklist based on your need of your work place. And the handoff checklist, it may contain the responsibility, the accountability, the uncertainty, the communicate verbally, acknowledged, and opportunity. And you might ask the question on the left-hand side to make sure the exercise is achieved. Check back is one of the tools or it's one of the communication strategy that are used to validate that the information is exchanged. And it starts by the sender when initiating the message. The receiver accept the message and provide feedback to confirm, to acknowledge that the message which has been sent is the same as the message that is being received. Then the sender verify the message that was received to close the loop. So this is example. A team member was asked by provider to administer the influenza vaccine to Mr. Green, who is in room 6. So you want me, so the receiver respond by saying, so you want me to give Mr. Green, who is in room 6, influenza vaccine? So the sender would say, yes, that's correct. The receiver then reply, okay, I will prepare the vaccine. Also, before I jump to the next slide, I would like you to think of a situation in healthcare setting where we are using the check back technique. So I think this is something I'd like you to answer. Maybe we can, Dr. Naif, we can see the chat box regarding a situation in the healthcare setting where check back technique is used.
Okay, I'm looking at the chat. There is like a situation like in the, someone said code blue OR,
Okay.
and even in the phone orders.
Exactly. Phone order. I would like to, as we,
Critical result.
yes, exactly, Dr. Naif. Critical result is one of the ESR standards, and it is one of the things that we apply the check back technique, make sure that the critical results, sent to the clinician or the physician on charge correctly as it is delivered from the machine. So critical result is one of the things that we are normally using the check back, or sometimes we say it as a read back technique to making sure that the result is the same as the one we extract from the equipments. So common challenges in healthcare, there are different challenges in communication in healthcare setting. I will go through them, and then we would like everyone to come up with a strategy to overcome these challenges. So I will start by inadequate handover, which is normally happening in the transition of care. And I start by the inadequate handover because it is one of the top contributor to the sentinel events. And it's happening when we move patient between departments or shift without structured hands-off. And we have to think about also the rush report, the missing chart, or the handwritten notes that are eligible. So this gap can easily result in delayed treatment or even the wrong care. So with regard to the inadequate handover, what would be the strategy you might think of to overcome this challenge as a communication challenge? So this question is for everyone to recommend or to suggest a strategy tool to overcome the inadequate handover. So we can use Spark as a communication
Written
tool.
note. Someone
Yes.
wrote.
Yes.
Spar.
Spar, yes. Exactly. So the second challenge is inadequate discharge planning or instruction. So this is another communication challenge in healthcare. For example, patient with very poor, or for example, if the patient often receive too much information before discharge, using a very complex language at the worst time, or right before leaving. As a result of that, they leave with confusion about medication, follow-up, or warning signs, which put them at risk once they are at home. So this is something regarding the planning for patient when they are discharged from the hospital. So what we might do to make sure that the patient are safe as a strategy. We can use teach back.
Clear explanation.
Yes.
Can be a form like discharge form with education for the patient.
Yes, and we can use as a communication techniques is to teach the patient, as we said, check back or teach back or read back to make sure that the message that is conveyed to the patient is or she's entitled to understood everything has informed or has given to them.
Even using
That
like clear communication with the patients.
Yes. Also, the limited English proficiency or the language proficiency, as well as literacy and health literacy deficiencies. Also, the cultural barrier is some of the communication challenges in healthcare. Also, age-related challenges. Age-related challenges, for example, children, adolescent, and other adults. Each of these categories are presented with unique communication needs, from fear of judgment to hearing loss or memory decline. We must adapt our style for each age group. Also, the errors in medical orders and test results, as I explained before. So now I would like you to volunteer to answer these three cases, case 1, case 2, and case 3. We'll start by reading the scenario. I would like to give a title for the scenario and what might be the outcome as a result of this scenario, and then what strategies we might adopt to overcome the challenges of this scenario. If you are ready, we can choose one volunteer from the audience to read the case, and then we will discuss it with him. Yeah, Dr. Naif, we can hear the voice of
Yes, I will. Okay.
or maybe no
Okay,
one
Dr.
would like to
Dr.
volunteer.
Bilal, do you hear us? Dr. Bilal?
Yes, I can hear you. My mic was on mute.
Okay.
Yes, Dr. Bilal, please introduce yourself and kindly read the scenario and explain it in your language as you understand from the presentation. And what might be the outcome? What is the title? Give it a good title. What might be the outcome and the lesson learned as of strategies to overcome the challenge that is existed in this scenario.
Okay, as far as I understood that it title can be given that improper communication. So scenario is the nurse failed to relay that patient was allergic to penicillin during a shift handover. The incoming nurse administered the drug, leading to an anaphylactic reaction. So I think that it's miscommunication, and to overcome this, the nurse must have documented properly and um, must have told to the next shift that the patient is allergic to penicillin, or put a chart or something print something and put on the patient bed that patient is allergic to penicillin. This is the
Excellent.
way that can we can overcome the scenario.
Okay, thank you so much, Dr. Bilal. Exactly what you have said. The case is about, we can give it a title of miscommunication during the hands-off. And the lesson learned of this scenario is to always use a structured handoff tool, which is I have explained in the presentation, the SPAR is one of the efficient communication tool during for most of the healthcare setting. Um, as you touch on the allergy status, uh, uh, some institution, they include allergy status as a standard elements in their system, so making sure not to forget about the allergy situation. Outcome of this scenario or outcome of this situation might be that the patient will stay in the hospital and length of stay will be extended in this hospital. And also the patient might be rushed to the ICU and to be stayed for
Yeah, definitely.
yes. So thank you so much, Dr. Bilal, for commenting on this scenario. So
Thank you, Dr. Bilal.
let's move to the second scenario. Would like someone to volunteer, then we will discuss it together.
أستاذة لبنى معك المايك. Hello, لبنى راشد. Okay, Minaha, you can speak. Just unmute, you can speak. Okay, Manzoor, you can speak now. I don't know if they have difficulties or.
Okay. I will give it one more chance.
Okay. Dia, you can unmute and you can speak. Dia. Okay, last one. Shiva. Yes, you can speak. Unmute and you can speak.
Okay, maybe I will volunteer to read the second case.
Okay.
Yeah. So scenario 2 is about patient with limited English proficiency, misunderstood the nature of scheduled procedure due to the absence of professional interpreter. The surgery was performed without proper informed consent. So this scenario is a scenario of a language barrier which led to surgical errors, and outcome of this scenario is the violation of the ethical and regulatory standard, as well as a legal precaution for the hospitals. Lesson from this scenario is to use a certified interpreter, not family member, as I explained before. Family understanding about medical terminology, patient understanding about medical terminology is not the same as the healthcare professionals. So not family member or bilingual staff. Also the techniques that we are know in healthcare is the teach back. So we must apply teach back method to confirm understanding. So we'll move to the third case. Maybe if someone want to volunteer before we jump into the thank you slide, the last slide.
Shiva, if you'd like to unmute, you can answer. I don't know if there is like a technical issue in the.
Could be, yeah. Okay, so the third scenarios is happening in the emergency setting. Physician verbally ordered hydralazine 10 milligram IV, but the nurse heard enalapril, leading to administration of the wrong medication. Okay, so the proper title for this scenario is verbal order misheard in emergency. Outcome as a result of this scenario could be a severe drop in the patient blood pressure as a result of the wrong medication, and we must acknowledge that as an incident report as a medication error. Lesson learned from the case scenario is to avoid verbal order unless necessary, and always write down, read back to confirm and to acknowledge the message that are sent by the physician. So impact on the patient outcome as a result of ineffective communication. It's a list of things that are might happen to the patient. An example is increased morbidity and mortality, patient mistrust and dissatisfaction. It's one of the things that is a result of the ineffective communication. High risk of malpractice claims as we are into moving towards insurance, and malpractice claims will be high as a result of issues resulting from the ineffective communication, and the long length of stay in the hospital, it will be increased, which will subsequently increasing the cost of treatment. Finally, to reinforce best practice and to use the standardized communication tool like SPAR, like checklist, like check back or read back. Also, we must promote safety culture, and this lecture is a great example of promoting safety culture all over the kingdom to leverage the knowledge about the effective communication across healthcare practitioners, train staff continuously, and that is uh, by scenarios, by case studies, by teaching them how to analyze issues and how to come up with a solution to overcome the challenges. Also using technologies like barcode verification, e-prescribing, making the most of the technologies, and finally by engaging patients because they are a cornerstone of the treatment uh, in techniques like teach back, visual aids, and making sure that the patient they are part of the planning. So when communication breaks down, as we have seen in the first video of the presentation, real stories and real consequences is happening. Thank you all for your attendance, and I hope that you find it fruitful with a lot of information, a lot of knowledge. I wish you all the best, and I'm hoping that you can apply the knowledge that you have learned into your practice.
Thank you very much, Dr. Muhammad, for addressing this interesting topic. Now we're gonna go with the questions and answers, and then we can just move on and wrap up. Okay, now we're just with the video and the breakdown of the communication, how it's impact patient safety. In the opposite of that, can you share an example where applying good communication framework turned in potential harmful event into a success story?
Thank you, Dr. Naif. Sure, that as we have touched on the SMART technology or SMART framework as an effective communication tool, I will give a brief story about a nurse who have noticed a post-operative patient becoming drowsy with low respiratory rate. Using SPA, by using SPA, she alerted the doctor about the situation by meaning that the patient is showing a sign of respiratory depression. B, post background, post-operative with BCA or point history of sleep apnea. Assessment respiratory rate is 8, level of oxygen saturation 88%, very drowsy, and then R for recommendation stopping the treatment of PCA, giving naloxone and moving to higher care. So as a result of that, the doctor acted immediately, and the patient is recovered safely to prevent potentially life-threatening event.
Okay. Thank you so much, Dr. Muhammad. Okay, and what about during code blue and during emergency? How how the approach of effective communication gonna be during these situations?
Well, this is another thing is of importance to have all the healthcare professionals familiar with, code blue is one of the things that is always happening within the hospital, and we must teach, we must educate, we must acknowledge that the healthcare worker inside the hospital know the scenario, know the situation, what might happen during the code blue, what might be the background, how to respond to that, and how to what kind of recommendation we might give as a result of the code blue. Because the lesson learned, which is the recommendation, always it is a lesson that will be of value to overcome mistakes that might happen in the future.
Thank you, Dr. Muhammad. I think there is no other questions. I would like to thank you on behalf of the Saudi Patient Center. We would like all of you thank you and thank the audience. As a part of the Saudi Patient Safety Center efforts to provide you with timely topics, please we appreciate if you would like to fill the evaluation surface into your email after the session. Thank you all for joining us today, and we look forward to welcoming you back in the future webinars, inshallah. Jazakum
Sir,
Allah
I have a
khair. Thank
question,
you.
sir. Sir, I have a question, please. I
Yeah.
have a
Yes,
question,
go on.
please.
Yeah. Go ahead.
I'm Dr. Shivashankar from Qasim University. I work for College of Applied Medical Sciences, and we practice in the Qasim University dental clinics. I have a question related to this effective patient communications in view of patient safety. Under which quality standard does this effective patient communication comes, and what are the mandatory documentations required to maintain under this standard, sir?
Sorry, I did not get that. Please, can you repeat your question, maybe?
Under which quality standard practices does effective communications come under, and what are the mandatory documentations necessary for this quality standard practice in patient care?
So, if I understand you correctly, you are relating to the SIPAHI standard that is discussing the communication, the effective communication standard.
Yeah, yes, sir. Yes. Because today we were all discussing about the effective patient communications, right? And we have seen some scenarios where some unintentional errors can happen.
Yes,
Okay,
definitely. It is one
so
of the
under which standard practice it is mandatory for a hospital to maintain, and what are the mandatory documentations we need to keep it?
Well, in the SIPAHI standard, in the quality chapter, you would find all the things that are relating to the communication, as well as the patient-related standards. It's plenty of standards that are relating to the effective communication as we discussed the readback, which is regarding the critical results reporting in the lab. This is one of the things that requires effective communication to be in place to make sure the critical results is sent correctly. But effective communication, it's all over. I think it's in the quality management chapter in SIPAHI, if I remember correctly.
Okay, sir. Thank you. And one more question, sir. Shall I ask last one? This will be the
Yeah,
last
go on.
one.
Yes, go
Which
on.
is related to one of the scenarios which you have mentioned. At that time, I had a technical issue. I couldn't ask you.
Yeah, go on.
It is kindly correct me if I am wrong, because usually if before any type of surgical procedure, particularly for major surgical procedure, we need to educate the patient related to what is that surgery is about, and how is it going to be performed to the patient in a simple way, not like complete details, but we need to educate them and make them understand this is a standard consent form. It is not like
Yep.
taking a mere signature in
Yep,
native
yep.
language is not sufficient. We need to actually sit with the patient, and then we need to explain them in a very simple way about the surgery, so that they can understand the related complications and then post-op recovery and everything. So what I
Yep, yep.
understand is that usually in these scenarios, not just the signature is sufficient, even there will be a separate room where along with the patient attend, the escort or the main attendant, we have to sit and we need to explain them, and this will be filmed.
Exactly. You are absolutely right. The thing
So
is that we need
yes.
to use a very simple language and avoid using the jargon. Uh, you know, as you know, some patients, they might be medically, they have medical background and they know the terminology of medical abbreviations, but not all patients, they have the same familiarity. So using very simple language, it's part of the patient right to know the procedure, what type of procedure, how long he might be in the hospital for, and so on. Yes, I totally agree with you, Dr.
Yes, sir. In our hospital here, we are not doing any videography as such, but we are just explaining because particularly when the patient is minor or major or even elder also, we want the patient guardian or responsible person be with them. And
Yep,
then we are
yep.
not filming any thing without the patient consent. We are
Yes,
not,
yes.
we don't even have that. But what is the current status, sir? Like what is the acceptable procedure as per the quality norms? In any standard practice, sir? Is it allowed to explain and make it as a like a video evidence, so that the patient is explained properly all the details of the surgical procedure?
It is all about, you know, consenting that the patient is agree of what you have to do with him. As I have explained throughout the presentation, patient is the corner of the treatment regime, and as the patient is engaged in the healthcare in his treatment plan, the level of satisfaction by default it will goes high. So patient should be engaged, patient should be notified, should be informed, and also whatever is happening, you know, or whatever is to be done with the patient, as you said, filming or doing anything with the patient, it has to be approved and consent by the patient.
Yes, sir. Yes, sir. And we also strongly advise the students in a very professional way that if they are even giving any type of injectable, for example, in dentistry where I teach, we local anesthesias day in and day out injections we administer to the patients. We make our students very clear that, see, whatever local anesthesia ampules are available in the working area, don't always consider that it is the duty of the dental assistant to check for the composition, label, expiry. No, it is finally the responsibility lies on the doctor or on the student who is going to inject that one. And we clearly tell them that, please, it is your due diligent duty to look into what is it, and then you cannot blame that, oh, dental assistant has kept and it is not my duty. No, it is not. Finally, when it comes, it has to, you are responsible. We clearly tell them that it's the highest standard of ethics when we are trying to inject anything in the patient's body.
Good. Thank you, doctor. Thank you for
Yes, so thank
active,
you
for actively
your
engaging.
presentation. Yes, so your presentation is really very nice, very simple, straightforward, very educative, sir. Thanks a lot. I don't have any other words than
thank you.
Jazakallah khair for you and your
Jazakallah khair.
family.
Thank you so much. Thank you, doctor. Thank you, Master.
Okay. Thank you again, Dr. Muhammad. Thank you everyone for attending this today, and we'll see you inshallah in the future webinars. Thank you.